Good morning, everyone, and welcome to Mid-Oregon Credit Union's presentation of the ABCs and Ds of Medicare, presented by Emily Carrick of Pacific Source. Welcome. Thank you for coming today, and we hope that you enjoy the presentation. So without any further ado, let's get started on our presentation. I'd like to introduce today Emily Carrick from Pacific Source, who has done multiple presentations with Mid-Oregon Credit Union over the years, mostly in person, but we had the opportunity to get together for the virtual webinar back in June, and it went very well. And Emily is an expert in this and does a great job of presenting. And Emily is coming on, and hi, Emily, how are you?
Hi, good. How are you doing?
I am doing very well.
Okay, thanks, Wayne. Good morning, everyone. As Wayne said, I'm Emily Carrick, and I'm an employee at Pacific Source, but I do want to reassure you this is not a sales presentation. Part of Pacific Source organization is that we really value giving back to the community. We are a not-for-profit organization, and one of the ways that we give back to our community is by sharing the knowledge that we have about Medicare. So this is purely an educational program. And I've been doing this for about 15 years now, believe it or not with Mid-Oregon, but I also teach this class at the community college and Ben Senior Center back before COVID, of course. I also do it quite frequently online. The COCC class is repeated about once a month. And I really enjoy sharing this information with people. Medicare is definitely confusing. We hear that all the time. But one of my passions is really to try and put things in plain English for you when I can, and to share any knowledge that I can with you to make it easier. The presentation is really geared towards people who are not yet on Medicare, who are going to be starting it soon and want to know things like how to sign up, how to choose a plan, and where to go for help. And the information that I have is still the 2020 Medicare information. Unfortunately, Medicare doesn't release their updated numbers for things like the Part B premium and the Part B deductible until very late in the year. But usually those are about the only changes from year to year, so I'm hoping that this will still be very useful information for you. So I'd like to start out and talk about the differences and really the overlap between things like Social Security, Medicaid, and Medicare. I'm sure most of you know what Social Security is, and that it's a program for people designed to be a pension of sorts, starting at age 62 and beyond, or also people who are disabled. But you may not know that Social Security is also the government organization that enrolls people onto Medicare. So keep that in mind when we start talking about how to sign up for Medicare. The sign-up process goes through Social Security. Medicaid sounds a lot like Medicare, but it truly is a different program. So Medicaid is a state program with also some federal funding. Here in Oregon, our Medicaid program is known as OHP, or Oregon Health Plan. And that's really a program to provide access to health care for people with very, very limited income and resources. Medicare sounds like Medicaid, but it's a truly different program. And it's a health insurance plan for people who qualify for Medicare, whether it's because they're turning 65, or there are also people of all ages on Medicare who may have qualified due to disability. And it is possible to have both Medicare and Medicaid, although that's not the norm. This is a sample Medicare card, and I just want to point out a few features of the card. Your Medicare number used to be, several years ago, it used to be your Social Security number, but they removed that. Now everybody is simply assigned a random set of letters and numbers, and they're not smart numbers. Like if you see on this card it ends in 72, that doesn't mean you were born in Oregon or anything like that. It's truly a random set of letters and numbers, and that was for your protection, so that if you're carrying around your Medicare card like they ask you to, and you were to lose your wallet, you haven't also released your Social Security number. And then there's two parts that make up what we call basic Medicare. So Part A, they call hospital insurance, but you might also think A for admitted, because Part A covers a hospital stay, also if you're admitted into a skilled nursing facility, or even if you're in hospice care. So those are the things that fall under the Part A category. Part B, they just call medical for shorthand, but you might just think of Be Well, because all of your day-to-day care, like doctor visits, lab and x-ray, those types of things, or any outpatient service where you're not admitted into a facility, falls under Part B. And then I want to mention your effective date on Medicare. When you get your Medicare card, it's really important to look at it carefully and make sure that you're aware of what your effective dates are, because that will drive your timelines for buying a Medicare supplement if you want to do that, or enrolling in a Medicare Advantage plan or a Part D prescription plan. So they are all tied to your Part A and B effective dates. So if you're starting Medicare because you're turning 65, your card will show that you're effective on the first day of the month in which you turn 65. So for example, this card that we're looking at here, their birthday could be March 20th, but it's going to show March 1st as their effective date. The one exception to that is if you're born on the first day of the month, you get to start an entire month ahead. So this card where it says March 1st effective, this person also could have been born on April 1st. So occasionally I used to get calls saying, I think they made a mistake on my card. It started the month ahead. So that's usually the situation. And this is the most that you'll see printed on your Medicare card. So if you buy other insurance or even get a Medicare Part D prescription plan, you will always have a separate card for that. And I am going to break down the differences between a Medicare supplement and a Medicare Advantage and the Part D. I'm going to talk about all of that later coming up, but just keep that in mind. It's always on a separate card. So now we'll talk about what you pay for Medicare. I will say as a whole, your Medicare Part A and B benefits, if you had to buy something equivalent to this on the open market, it would probably cost over $800 a month. So while you do have to pay a portion of that, it's a relatively small portion. So for Part A, which is the hospital portion, most people pay nothing for Part A because you've probably paid into it. You just had to pay in to Social Security or your Medicare benefits for at least 10 years to qualify for premium-free Part A. Or if people didn't pay in themselves, they typically qualify through their spouse. Part B, almost everybody can expect to pay the standard monthly Part B premium amount. And for 2020, it's $144.60 a month. So again, you're paying $144, but you're getting a policy valued at over $800 a month. So you really are finally getting some benefit back for all the years that you paid into it. So these amounts they could change in 2021 or they could stay the same. I've seen Part B go up, I've seen it go down, and I've seen it stay the same. So when I first started in this business back in 2005, Part B premiums were just under $100 a month. So they've gone up about $45 over the last 15 years. They are also tied to Social Security increases. There's a hold harmless provision. If Social Security doesn't increase by a certain amount, they cannot increase your Part B premium. I haven't yet heard if that's going to apply this year or not. If you have a very low income, there is a program where the state of Oregon will actually pay your Part B premium for you if you qualify, even if you make a little bit more than Medicaid. And if you have a high income, they will actually charge you more. And the way that they do that is they look at your income from 2 years ago, or basically your tax return from 2 years ago. And if you're single, they're going to look at your income from 2 years ago. If you're married, they're going to look at both of your incomes and combine them. So for a single person making over about $85,000 a year, or if that was your income 2 years ago, you can expect to pay more. And for a married couple making a combined amount over $170,000, you can expect to pay more. And it can go up pretty high. I've seen it go up as far as over $400 per month per person. So that can be a significant expense. So if you did have a high income 2 years ago, just keep that in mind. You can find more detail on that by going to Medicare.gov under what do I pay for my Medicare, or you can always call our local Social Security office. I'm going to give you that phone number and you can ask. And when you start Medicare, if you're drawing Social Security, they're just going to deduct your Part B premium automatically each month from your check. If you're not drawing Social Security, they're going to send you a bill in the mail, and it comes once a quarter. So be on the lookout for that. And you really need to pay that and make sure you always have Part A and B, because you need to be enrolled in both Part A and Part B to get a Medicare supplement plan or a Medicare Advantage plan. And for the Medicare prescription plan, which they call Part D, you really only have to have A or B, but most people would go ahead and have both. So let's look at a traditional hospital stay and just show, you're not covered 100%. Unfortunately, you do need to pay a certain amount out of pocket. So look in the column to your left under Part A. If you're in the hospital and you just have Medicare, you don't have any other coverage, you would owe about the first $1,400, and that would cover you for up to 60 days in the hospital continuously. It's pretty rare to be in the hospital, frankly, more than 3 days. That's the average stay right now. But if somebody were in the hospital 61 to 90 days, it would become quite expensive, because at that point you would owe $352 each day, and then that amount doubles from 91 to 150 days. But again, that's so rare. Typically, if people still need a lot of care, they get moved to a skilled nursing facility where you're covered for up to 100 days under Medicare. And there could be a few physician services while you're in the hospital that you may get charged 20% for, so we like to mention that. On the right-hand column of the chart we have a few examples of things that fall under the category of Part B. So typical visits to see a doctor, or even an outpatient surgery like cataract surgery. You go in, 5 minutes later you're done apparently. Those are just a few examples that we've listed there to show what falls under Part B. So for these services, if you just have basic Medicare, you're going to pay an annual deductible, and this changes a little bit from year to year. So currently it's $198. And then Medicare will pay 80%, and you'll pay the other 20% for the remainder of the year. So if you're not familiar with the term coinsurance, at the bottom of the screen where it says 20% coinsurance, that means that you pay 20% of the Medicare allowed amount, and most providers will write off the difference. There are a few providers that have a contract that allows them to balance bill you up to 15%, but in my experience, very few providers do that, because you can imagine it doesn't make their patients very happy. So in general, Medicare is what we call an 80-20 plan. Generally, Medicare pays 80%. Generally, you pay 20%. So Medicare is a good program. I know it sometimes gets a bad rap, but I'm here to tell you from experience that it is a very strong medical program, but it's not perfect, and it doesn't cover everything, because no health plan does. So unfortunately, they had to prioritize the most, life-saving, most important services and make sure those were covered. And then there's a few things that fell below the line for coverage, and there's just not enough funding, unfortunately, to build into the Medicare program. And the one that we get asked about almost every day is dental. So dental is a tricky one. There are dental policies you can buy, even when you go on to Medicare, but I would encourage you to compare what your annual premium cost would be versus what the annual benefit amount will be on the plan, because typically you're not going to get a whole bunch more out of it than what you pay into it, and they do have waiting periods typically. So I would recommend checking with your dentist Sometimes dentists have a loyalty program that they've come up with, sort of their own informal insurance plan for their patients, or maybe they do have experience with a dental program that's been working well for their folks. Alternative care is covered in such a limited way by Medicare that it's on our list of what's not covered. So alternative care includes things like visits to a naturopathic doctor, which unfortunately are not covered by Medicare. The category of alternative care also includes chiropractic care, which is covered very limited, in a very limited way by Medicare. It's only for one billing code, which is manual manipulation of the spine to correct subluxation for acute conditions. So it's not ongoing care, maybe for a car accident you had several years ago that you still need care for. Also, you would have to find a chiropractor that bills Medicare, and a lot of them don't because a lot of what they do is not covered under Medicare. And then there is a small benefit for Medicare that was introduced earlier this year for acupuncture, but it also has a lot of strings attached. It's only for a single billing code of lower back pain, and you have to find someone that will bill Medicare, so it's limited. If you have a long-term care insurance policy, I would encourage you to keep it. It's definitely not going to be replaced by Medicare. And Medicare is not intended to just simply pay for what we call personal care services for the ADLs, or the activities of daily living, if you've ever heard that term. I know my grandmother was living on her own into her mid-90s, and she could have used some help with the ADLs, like bathing, dressing, meal preparation, getting in and out of her chair. Those things aren't covered by Medicare. So you either have to be prepared to ask family or friends for help or pay privately for that. There's such a small benefit for glasses that once again it's on this list, unfortunately. So Medicare has a benefit that's about a $50 value to replace the lens in your glasses if you've recently had cataract surgery, and that's it. And there is no coverage for hearing aids. So I know hearing aids are very expensive and very important for our quality of life, but there's just not enough money in the program to cover that. And I know right now, unfortunately, we're not traveling, but someday when we can leave the country again and go see other places, just know that Medicare, for the most part, doesn't work outside of the U.S. except for limited areas along the border. So if you are planning a trip to Europe, be sure that you find out if you have other medical insurance. You can't use your Medicare and they won't reimburse you. So you can call AAA or a travel agency and ask to buy a short-term travel insurance policy, which is pretty affordable because they're only covering you for 2 or 3 weeks while you're gone. Or if you do have a Medicare supplement or a Medicare Advantage plan, ask them about foreign travel emergency coverage. Some of them do have that. Now we're going to talk about signing up for Medicare if you're not yet on it. Many people are automatically enrolled and others need to actually sign up. So the key is, are you collecting Social Security? So if you're going to be turning 65 and you're drawing Social Security now, you will be automatically enrolled onto Medicare, both A and B. And you'll know you're enrolled because they'll send your card out to you, your Medicare card, and they do a good job usually sending it out pretty early, at least 3 months before your birthday. So be on the lookout for it. If you haven't received that and your 65th birthday is coming up, you should call Social Security and tell them, I haven't received my Medicare card, because you should get it early. And once you get that card, as I mentioned earlier, I encourage you to look at it carefully, make sure everything looks correct on there. Occasionally mistakes are made. So make sure everything looks correct, and then you're good to go. You don't need to do anything more through the government. It's at that point that you can shop for the extra coverage if you want, which we'll talk about those options coming up. If you're not drawing Social Security, and I talk to more and more people these days who are not, keep in mind you have to sign yourself up for Medicare if you want to start Medicare at 65. Now, we're going to talk in just a minute about other coverage, like if you're still working and you have employer insurance, or if you're covered under your spouse, you have different options. But let's just assume you're going to be turning 65, your current insurance is going to end, or you don't have any other current insurance. You do need to sign up for Medicare. The easiest and quickest way is to do it online. So I would really plan to do it that way. I don't even know if you can meet face-to-face with them right now. I haven't called them to ask, but just go to ssa.gov, and the soonest you can do it is 3 months, the first of the month, 3 months before your birthday month. So, don't do it too far in advance. 2 to 3 months is the rule of thumb that it's a good time to do it. And typically you'll get your card in the mail about 3 weeks later. If you do want to talk to somebody local, again, I haven't tested this number, I should do it, but I'm giving you all the super secret, hard to find phone number on the bottom of this slide that will ring into our downtown Bend Social Security office. So everybody on the call today probably has a slightly different situation, and this is why I really encourage you to sit down with someone or to have a phone call with somebody. I'm going to give you some resources at the end to figure out what is the best option for you, because you may have the option to stay covered under an employer plan, whether it's your own or your spouse's. And you almost really need to do a cost-benefit comparison. Don't always just assume that your current plan is better than a Medicare plan. It's good to have somebody help you compare those. There's a general rule of thumb that if the employer has 20 or more employees, then you can choose which option is better for you. And I usually recommend not doing both because, it's expensive to pay Medicare $144 every month. And if you already have a very robust medical plan through your employer, that really could be wasted money. So if you work for an employer with 20 or more employees, you can wait. You can just not sign up for Medicare, or you can decline Medicare, and you won't be penalized as long as you get back on or sign up for Part B later when you come off of that coverage. And you can do that up to 8 months after that coverage ends. So if you have an employer with fewer than 20 employees, you do need to sign up for Medicare. It's intended to be your primary insurance. And I would talk to somebody about whether or not you should keep your employer plan. It may or may not help supplement your Medicare. It's kind of difficult sometimes to see whether that's going to be a benefit or not. And this last part is really not common. In the 15 years I've been doing this, I think I've only talked to 2, maybe 3 people over the years that said, I just never signed up for Medicare. I took the Part A because there was no cost, but I didn't take Part B, and I don't have other insurance. I just decided I didn't want to pay for Part B. Usually that's not the best move because, number one, you could be waiting a long time to get back on Part B if your health should suddenly change. So let's say I was eligible for Medicare 2 years ago and I never signed up for it and I don't have any other insurance. If I want it now, I have to wait till January. They have this weird time frame. I'd have to sign up for it in January and they won't start it till next July. So that's not recommended. And they'll also charge you more for it permanently because you weren't paying into it like everybody else was. So you'll have a permanent 10% annual premium penalty applied to your Part B amount. So people will sometimes ask, do I have to get a Medicare supplement? Do I need a Medicare supplement, or is basic Medicare enough? Well, a lot of it just depends on your situation and your finances, but here's what I tell people. I say, well, Medicare is good coverage. It generally pays 80%. But if you have something very expensive going on, like the one thing that always comes to mind is if you ever needed chemotherapy, you're going to owe 20% of the cost of chemotherapy, and that would be many, many, many thousands of dollars. And Medicare doesn't have an annual out-of-pocket limit, whereas many medical plans, you pay a certain percentage, but only up to a certain dollar amount. And then that's basically your financial safety net. Medicare doesn't have that. So you'd be owing 20% for something potentially very expensive. So you just need to understand that. So a lot of people will at least look at other options to add to their Medicare. You certainly don't have to, but it's not a bad idea, especially when you're first starting Medicare, because you'll have all these options available to you, basically guaranteed issue or guaranteed acceptance when you first start Medicare. So the first style of plan, I'm sure most people are familiar with already. They've heard about people that have a Medicare supplement. These plans use their own alphabet lettering system just to make things more confusing, I think. So the most popular used to be called a Medicare Supplement Plan F, but that plan, you're grandfathered in if you have one now, but if you're just starting Medicare now, you can no longer buy a Plan F. So the next best one is called Plan G, and I'll talk a little bit more about what that means later on. But if you hear someone say, I have a Plan F or a Plan G, they're talking about a private Medicare supplement plan from a private company. These are also called Medigap policies, in case you hear that term. There's so many companies that sell these, and I want you to know it's a commodity product like a gallon of milk. So a gallon of milk can cost you a different amount depending on the grocery store you go to, but it's pretty much a gallon of milk. So same goes with a Medicare supplement. You know, a Plan G might be more expensive, and I'm just going to use some names. It might be more expensive at Bankers Life than Mutual of Omaha or AARP, but it's all the same coverage. So different companies can charge more for the same coverage. And part of it could be perhaps their customer service or their brand recognition. One of the resources I'm going to give you at the end of this to work with is an independent insurance broker, because, and I work with about 60 local brokers throughout Central Oregon and the Gorge. The advantage of talking to them is they know the trends. So there are companies that will introduce a Medicare supplement at a very low premium, and then within 3 years, it's the most expensive one out there. Whereas you might start out on one that's a little bit more expensive, but it has a stable premium, so you don't have to change around. So there's some things that are helpful to know by talking to a professional. And the Medicare supplements never include the prescription benefit, which is called Part D, D for drugs. So you can buy what's called a standalone Part D prescription plan from any company that sells one. And that they have to meet a certain minimum standard of coverage. The Medicare Advantage plan, or sometimes these are called Part C or Medicare Health Plans, is the other style of plan. These tend to have a lower monthly premium than a supplement, but higher out-of-pocket costs. So you might pay higher co-pays for things. You just have to kind of look and see if that trade-off would make sense for your situation and your budget. They're sometimes called all-in-one medical plans because they cover all of your Medicare benefits plus some extras, and the Part D prescription benefit is usually included. So just to give you a ballpark estimate of what these might cost, and these are rough numbers, just nationwide numbers. So at age 65, a typical supplement might run you around $140 a month. And then if you wanted to add on to it, which I would encourage you to do, a Part D prescription plan, the national average right now is close to $30 a month. And that, again, is in addition to your Medicare. You always have to pay the Part B premium, that $144. And then the Medicare Advantage plan, the national average is around $70 a month with prescription coverage included. So it's about half of a supplement. But again, you have to consider your out-of-pocket costs, because you will have potentially a lot more out-of-pocket costs because there's co-pays attached to most things other than preventive care. And another way to look at this is the cards that you would have in your wallet. So on the left-hand side, it shows if you buy a Medicare supplement plan, you really do need to carry your Medicare card around in your wallet. because you're going to present that at the doctor as your primary insurance. They're going to bill Medicare for the 80%, and then they'll bill your supplement for the other 20%. And then if you want prescription benefit, you're going to buy that separately and have a separate card in your wallet that you'll show at the pharmacy. Sorry, that's my dog barking out there. Medicare Advantage plans, you still have Medicare, but you don't need to carry your Medicare card because you don't need to show it at the doctor. It actually confuses things if you do that. So you're just going to show your Medicare Advantage plan. The doctor bills the plan directly, and then the plan gets reimbursed by Medicare. So Medicare is still helping to pay for your care, but it's a little bit complicated. They pay a certain amount every month to the health plan for each member on the plan. It's an average amount that they've pre-calculated. So now I'm going to take a little bit of a deeper dive on each of these different styles. And I know from feedback I've received, it's hard through this presentation to maybe identify which style is better for you, a supplement or a Medicare Advantage plan, because we're not looking at the specific numbers. So it'll be a lot more clear to you when you sit down with someone or have a phone consultation with somebody and you start talking about the costs of the monthly premium and the copays. That'll help you sort through which one's better for you. So as I mentioned on the supplement, it really is secondary coverage that pays after Medicare. The plans are commodity products or standardized. I'm not going to go through all these different levels of coverage. It's kind of ridiculous how many they have when really there's two that are the most popular, Plan F and Plan G. So here's a little update on Plan F. Plan F paid the full 20% after Medicare paid 80%. So people truly had 100% medical coverage. Unfortunately, what that led to was some abuse of medical services. I'm not saying anyone on the call here today would do this, but there could be somebody that perhaps was lonely and would make frequent appointments to visit with their doctor because they had zero skin in the game. They didn't have to pay a dime. So Medicare identified that that was an issue. And so if you were on Medicare as of last year and you had a Plan F, you could keep it. But if you're starting Medicare this year or in the future, you cannot buy a Plan F, but you can get a Plan G, which is the next best thing. The only difference with the Plan G is you do have to pay about the first $200 of your medical care per year, and that's the Part B deductible. So they just needed people to have a little bit of skin in the game to make sure that there wasn't abuse of services. And another thing to remember is these are what I call copycat plans because Medicare has to first step up to the plate to pay their 80% before your supplement will pay. So they typically only follow and cover things that are covered by Medicare. So just an example, if you're going to see a naturopathic doctor and you're hoping your supplement will pay for that because Medicare doesn't, unfortunately, it doesn't work that way. If Medicare doesn't cover it, your supplement won't pay anything either. But one thing that is nice on these plans, especially if you're somebody that splits your time between, say, Arizona and Oregon, or if you're a full-time RVer traveling around the country, you can see any provider or doctor in the country that accepts Medicare. If you're not an established patient, you need to make sure they're also taking new Medicare patients. And this is probably a good point for me to say, if you're not yet on Medicare, please be sure to get established with a primary care provider like a family practice or internal medicine or general practice doctor prior to starting Medicare. That's really important because there are some clinics that will not take new Medicare patients. But if you were already a patient prior to going on to Medicare, they will keep you. And you do need to see them probably at least once every 2 years to maintain and be active in their practice. The supplement plans can be expensive and they can get more expensive over time. So that's the downside. The coverage is very good, but it comes with a high sticker price. So They are age rated, and they use what are called age bands, which means a 65 to 70-year-old will pay a certain amount, 71 to 75 will pay a higher amount, and so forth. They also do vary by what you pay can vary based on whether you're male or female and whether you use tobacco products or not. And you always have to pay your Part B premium. So this does not replace what you pay for Medicare. You're really buying extra insurance. So the other style of plan, and again, neither one is better or worse, a supplement plan or Advantage. I've had people say, I just want the best. Well, the best depends on your needs, your situation, your health, your travel, your prescriptions. So there's a variety of things that can go into finding the best plan for you. So this style of plan, as I mentioned, gets billed directly and then reimbursed a certain amount from Medicare, which is what we call a per member per month. So they send a set amount per month to the health plan based on the average cost of care. A lot of Medicare Advantage plans will offer some extra benefits for things like glasses or hearing aids or fitness like Silver and Fit or Silver sneakers. These are nice to have, but I would caution you, never choose a plan just because of the little extras. You really want to make sure it's going to work well for you if you have a major medical situation. Typically, the trade-off, these plans tend to be less expensive each month, but you do have a copay for things like, for example, maybe you'll pay $20 every time you go to the doctor. Maybe if you're in the hospital, you owe $300 a day for the first 4 days. Those are pretty typical copays for Medicare Advantage plans. But you're still getting better coverage than Medicare alone because these have the protection of an annual out-of-pocket maximum. So if you recall, earlier I talked about if you have basic Medicare, you pay 20% across the board and there's no limit. This is very important. On the Advantage plans, you may pay some out-of-pocket costs, but there's a point during the year where the plan will cover you 100% if you've paid out that much. And the annual out-of-pocket maximums, I've seen them vary quite a bit from plan to plan. An average amount might be $5,000. And it doesn't mean you're going to pay $5,000, but if, let's say you got chemotherapy and you had to pay a high out-of-pocket amount for chemo, once you pay $5,000, you would be covered 100% for all of your medical care till the remainder of the year. So that's a really important feature of Medicare Advantage plans. You do need to commit to seeing providers in the plan's network for anything you would make an appointment for. You're always covered for anything unexpected that needs care right now. And that would be not only emergency room care, but also urgent care visits. So you're always covered for that, as well as ambulance. I should mention that anywhere you go. And the Medicare Advantage plans can be a lot less expensive than the supplements because the monthly premiums are not age rated. So if everybody on the call today is on Medicare and the plan is $70 a month, you can all get it for $70 a month. It doesn't matter what your age is, if you're male or female, or whether you use tobacco or not. They don't ask those questions. Okay, Wayne, we have our second stopping point, so I'd like to open it up if there are any questions in the Q&A box.
Okay, yes, we did get some. So we had a question about the Ben Social Security office phone number again. It will be on the slide. You can download at the end of the presentation, but I'll mention it since I've already written it down. It's 1-877-405-0302. And our next question is, can you continue, assuming you can afford, private health coverage and also have Medicare?
So if by private health coverage, if you mean an individual plan like through the marketplace, no. And it wouldn't make sense to do so, quite honestly, because those plans are typically very expensive. You may be getting a subsidy, but if you were to keep it and go on to Medicare, you would lose that subsidy. So it absolutely would not make sense to do so. So no, you wouldn't do that.
Okay. The next question is, I am working full-time and have Pacific Source Insurance. I am 65. Would it be smart to sign up for Medicare Part A as an additional source of coverage now? I don't plan to retire until age 70 if possible. I may go on part-time in the last couple of years if possible.
Okay. Well, thanks for being a member, first thing. You know, it's kind of a toss-up. It doesn't hurt to sign up for Part A, so you could do that. If you want Part A only, I don't think their online system through Social Security allows you to do that. So you probably need to call them and tell them you want to sign up for Part A only. The only caveat to that is you cannot continue to make contributions to a health savings account if you're doing that, but most people aren't doing that. So as long as you're not contributing to a health savings account, there's really no harm in signing up for Part A only.
Okay. Boy, we're getting the questions in now. We may have to hold some till the end, but let's see what we can get through. Can you talk about the prescription drug cost donut hole?
Yes, we're going to get to that. So let's hang on to that one. I have my next section coming up on Part D.
Okay. Do Plan Gs not have an annual out-of-pocket max limit?
Good question. So Plan G, because it's structured differently, it doesn't really need one. All that you're ever going to pay out of pocket on Plan G is about $200. So that's the annual deductible. And then after that, you're covered 100%. So really the annual out-of-pocket maximum is the same as the $200 deductible.
Okay. Is the supplemental plan the one that is better when you travel as compared to the Medicare Advantage plans?
It's a great question. I get that one all the time. The question I ask is, how long do you plan to be away? If you're almost doing a second home situation, or you're gone, 3, 4, 5 months, I would probably go with the supplement, because you might want to make appointments with local doctors while you're away. But if you're truly just visiting or taking a trip, it really doesn't matter, because the Medicare Advantage plans will cover you. You can just go to the nearest urgent care clinic or nearest emergency room while you're on vacation. So the difference is, and this is how I ask it, are you planning to make doctor appointments when you're out of the area? And if the answer is no, then you can go with either style.
Okay. Do you have any expertise regarding how TRICARE and Medicare interact in the case of a military retiree?
Ooh, I do have a little bit of experience with TRICARE, and they have a lot of rules. I know that you cannot have a Medicare Advantage plan with Part D included if you have TRICARE, or you risk losing TRICARE. But some people will get just the Medicare Advantage plan without drug coverage, because they may feel it gives them a broader network of doctors to choose from. I would defer to TRICARE for any other questions beyond that, because I certainly am not a TRICARE expert, but that is a little bit that I do know about it.
Okay, well, that's probably helpful. What if you have been self-employed prior to Medicare availability?
If you've been self-employed prior to Medicare, I'm not sure I understand that question. Maybe we can have them. You're still eligible for Medicare. I don't know if you're talking about the eligibility for Medicare, but as long as you've paid into the Medicare system for at least 10 years, then you're eligible for the premium-free Part A and the subsidized Part B. If you do have any questions, and if that's still not answering it, you're always welcome to call me. I'm the only Emily Carrick at Pacific Source, or you can call Social Security, and they can also tell you about your eligibility.
Okay. Well, if we get a further detailed question that clarifies, we'll ask that. But for now, we'll move on.
Okay.
My 92-year-old mother moved here from Portland, and her Advantage plan was not available here in Bend. Why is that?
Okay. So, yes. Medicare Advantage plans do use a network of providers that they contract with to get discounted rates, and that helps keep the premiums down. So you do have to live within a certain area or a certain number of counties to be on a certain Medicare Advantage plan. So she does have the opportunity, because she moved, to change her plan. I hope that it was recent if you are still shopping for a plan, because there's generally a 2-month window after you move where you can change your plan. It is common if you move to another part of the state or into another state that you do need to change your Medicare Advantage plan.
Okay. And kind of a clarification about the working until age 70 with Medicare Part A. Just to be clear, if I want Part A only while I still have an employer-based insurance, how do I sign up for Part A?
You would need to call Social Security to do that. Their online system doesn't allow that.
Okay, that's it for right now.
Okay, great. Well, thank you all for the questions. I appreciate that. We'll keep going, and then again, when we're finished here, we can hopefully answer any others that may come up. So now we're going to talk about Part D, which is the prescription plan available for people with Medicare. And when I first started out, I got hired in 2005. This didn't exist. So at that time, if you were on Medicare and you needed help paying for your prescriptions, there were all these discount cards, prescription discount cards you could sign up for, but it was so confusing because looking at them, you couldn't tell which was going to be better than the other. So in 2006 is when they introduced Part D, and while it's definitely not perfect, I can tell you it's so much better than what was before, which was really confusing and unclear. So the first thing is, you don't get a Medicare Part D prescription plan from Medicare, which sounds very logical that you would do that. The situation is that Medicare designs a standard or a minimum standard of coverage and then tells the insurance companies, here's what you can offer, and you can call it a Medicare Part D prescription plan as long as it is at least as good or better than a certain standard of benefits. So there's tons of companies that sell them. I would say these are not a commodity product because while they all have to meet a certain minimum, some can have higher or lower prescription drug deductibles, and that can affect what you pay for the plan. They all do have to cover a certain number of medications for each condition, but not necessarily the same brand of medications. So that can be different as well. And I really encourage everybody when you first go on to Medicare to sign up for a Part D prescription plan, even if you don't feel like you need it right now because you don't take anything or the medications you take are so inexpensive. The reason being is if you don't have any other prescription coverage and then you want to get a Part D prescription plan later on, you're going to pay more for it. It's called a lifetime late enrollment penalty. Doesn't mean you broke any rules. It just means they're going to charge you more. Now, the person on the call who's with Pacific Source, you don't need to worry about that because our plan is what's called creditable coverage, which means if you're working past 65 and you have our plan has equal coverage or better actually than the Part D prescription, so you won't be penalized later. If you have employer coverage through another company outside of Pacific Source, most likely you have Part D creditable insurance as well, but it's good to call your insurance company if you're not sure and just make sure that it's at least as good or better than Medicare so you won't be penalized. There are some exceptions. With Medicare, I joke that there's always the one rule and then 25 exceptions below it. So if you are a veteran and you're enrolled in the VA health plan, you don't need to buy a Part D prescription plan because you have creditable or equal coverage to Part D through the veterans. If down the road you find that maybe they don't cover a certain medication for you or you just want more coverage, you can buy a Part D prescription plan from a private company without penalty. If you have TRICARE, it's a little more complicated. Generally, you're just going to use their prescription plan, but do check with them if you have specific questions. And for most people, if you're not just starting Medicare and you want to sign up later for a Part D prescription plan, you can only do it during a certain window during the year. So right now, this is my busy season because this is when people who are already on Medicare are making changes to their plan. So that includes the Part D prescription plans, if they want to sign up for one, or if they want to drop it, or if they want to change to a different company. In most cases, it needs to be done between October 15th and December 7th each year, and then it goes into effect in January. So this is really just pre-enrollment for 2021. Now, I used to have a whole big long slide about the Medicare donut hole, but I'll tell you why I don't have that slide anymore. Essentially, the donut hole has gone away. And for those of you who don't know what I'm talking about, if you picture a round donut, you've got something and then a hole in the middle and then something else at the bottom. When these plans, the Part D plans, first came out in 2006, you had insurance up until a certain point, and if your prescription drug costs reached that amount, which was several $1,000s, the insurance stopped paying for a while. So you sort of fell in a hole. And you had to pay 100% of your prescription costs until you had spent another threshold dollar amount, at which point the insurance kicked back in again. It was a cost-saving measure. They were trying to offer more coverage for the majority of people on Medicare who did not have that high of drug costs, but it sort of backfired, and Congress heard a lot about it because, you know, the 10 to 20% of people on Medicare that fell in that donut hole, it was a real hardship. So what they did was they chipped away at the 100% over the years that people had to pay, and now it's down to 25%, which is the actuarial equivalent to the copays that you pay at the beginning of the year on most Part D prescription plans. So I know that might sound confusing. Let me try and say it a different way. On most Part D prescription plans, when you first start out in January, you may have a deductible to meet or you may not. It depends on the plan. And then they'll tell you, you know, for generics, you're going to pay this copay. For brand names, you'll pay that copay and so forth. If you have really high drug costs during the year, which exceed about $4,000, which is not common, then instead of paying those flat copay amounts, they're going to charge you 25%. And again, the actuaries who create these programs tell us that on most plans, you've already been paying something close to 25% in the form of your copays. So that's a long explanation to say most people don't need to worry about that any longer. So there's a variety of ways you can configure your Medicare, and I know it's confusing, but it's good you still have some options. Somebody could maybe just have Medicare alone. They can't afford the extra cost of a supplement or an Advantage plan, but there are Medicare Part D plans available for as low as about $12 a month. It's not going to be the greatest plan, but you could at least get something basic to avoid a penalty later. Or if you want more of the full coverage and you can afford to pay that, you could add a Medicare supplement like a Plan G, where again, you're covered almost 100% after you spend the first $200. And again, they don't include prescription coverage in the supplements, so you would need to look at getting an extra Part D plan to go with it if you want. And then the Medicare Advantage plans typically include Part D, so you would get all your coverage all in one. There's a really great program through Social Security that a lot of people are not aware of, so we're always trying to spread the word. If somebody has very low income and has trouble buying their prescriptions or even buying a prescription drug plan, the program with Social Security is called Extra Health. That's actually the name of it. So, and these amounts do change from time to time. They have not released next year's figures yet. But if somebody has very limited income and very few assets, it's worth applying to this program, and you would apply by contacting Social Security. You can either apply online through their website or over the phone. I do want to mention on the asset side, they don't count the value of your home or your car, but if you have savings, that's going to be counted, or if you have stocks or bonds, that's going to be counted. And on the income side, sometimes people ask if they count your Social Security income, and yes, they do. Okay, we're going to wind down here and talk about the enrollment opportunities on when you can buy extra coverage for your Medicare if you choose to do so. So if you're just starting out, let's say I'm going to be eligible next month for Medicare. I am what we call new to Medicare. I can buy a Medicare supplement if I want, and anytime within 6 months of my Medicare start date, it's called guaranteed acceptance, where they won't ask me a single health question. So even if I have 5 chronic conditions, they cannot turn me down. To get a prescription plan, it's a shorter time frame. I need to do that within 3 months. So really, in my experience, the best time to shop for these things is in the 3-month window before your Medicare starts, because once your Medicare starts and the months pass by, your options might start to decrease. So if you can do it in advance, that's my recommendation. The Medicare Advantage plans, you can sign up within 3 months of starting Medicare. In 2020, there is still a question that's on the form asking if you have kidney failure or what they call end-stage renal disease. But good news, that question is going away next year. So starting in 2021, both of these plans will be guaranteed acceptance for anybody regardless of their health conditions, as long as you sign up frames. So you can sign up for Medicare Advantage within 3 months of starting Medicare. So 3 months before or up to 3 months after. But let's say you started Medicare several years ago and you just never bought any other coverage. You can apply any time during the year for a Medicare supplement. I know it's confusing that like a Plan G doesn't have an open enrollment. You can apply for that anytime, but they do still have the right to ask you some health questions if you've been on Medicare longer than 6 months. So you do need to qualify. It doesn't mean you have to be in perfect health, but they're trying to rule out somebody who didn't buy insurance and then they suddenly get a big diagnosis. So they might ask if you've been hospitalized recently or if you have a surgery coming up, things like that. And the Medicare Advantage plans is another reason why it's a busy time of year for me, because this is the time of year people who either want to sign up for a Medicare Advantage plan, who are already on Medicare, can do it during the fall, or they can change their plan or leave their plan if need be. And again, this is pre-enrolling for next year. So if you're seeing lots of ads on TV for Medicare and all this, all of that applies only to Medicare Advantage plan options and Part D prescription plan options. There's another time period, just to make it more confusing. During the first 3 months of each year, if you're already on a Medicare Advantage plan, you could make one additional change if needed during the first 3 months of the year. You could switch to another company that offers a Medicare Advantage plan if that looks better to you. You could leave the plan. You can add prescription coverage to it or drop it. So I think that's nice. It lets you try it out. And if you find that you needed a different plan, you can make that change. There's a lot of exceptions to those enrollment rules I just gave you. If you have a qualifying event, like the person whose mother just moved here from Portland, it's typical that if you move here from the Valley or anywhere along I-5, you may need to change your plan. We just have different plans that contract in this area, which is considered a rural area. So if you've recently moved, or if you're coming off of an employer plan, or if you have the extra health program due to low income, there are different opportunities during the year if you have a qualifying event where you can make a change. And there are probably about 12 special enrollment opportunities, but these 3 by far are the most common. All right, so probably the hardest way to choose your Medicare plan would be to call all the different companies and ask them to send you information, because they can be really hard to compare, and there's a lot that you don't see on paper, like how fast do they pay their claims, how's their customer service, what's the hold time on the phone, things like that you're not going to see in their materials. So I really encourage you, if you need some help, to meet with one of these independent resources I'm going to give you. So the first is called SHEBA, and SHEBA stands for Senior Health Insurance Benefit Assistance. These are actually state-trained Medicare certified counselors, but they are volunteers. You can call this number on the screen to make an appointment. It's 541-678-5483. We are very fortunate in Central Oregon that we have some really knowledgeable SHEBA volunteers that you can meet with. They're only doing virtual appointments this year, so keep that in mind. Also, part of my role at Pacific Source is I work directly with all of the independent insurance brokers throughout Central Oregon. So if you need help finding somebody, let me know. I really like working with the brokers because they have an insurance license. They're not a volunteer. They're doing this as their livelihood. And there are brokers that truly do specialize in Medicare. And it's free to work with SHEBA. It's also free to work with an insurance broker. You don't pay any more if they enroll you on the plan. They get paid a commission by the insurance companies because there just aren't enough of us at the insurance company to do all the one-on-one appointments that are needed. So they're just really an extension of us. But they're independent, so you can meet with them and they'll show you, MODA versus Humana versus Pacific Source versus Providence. They can put all those plans side by side. And truly, they get paid about the same from all the plans. So they're going to be motivated to help you find a good plan. Another way you can find a broker if you want is on the State of Oregon website. It's healthcare.oregon.gov and click on Find Local Help. But if you really do want to try and do it on your own, visit Medicare.gov. They have a really robust website where if you choose, you can enter in some of your personal information and it'll help narrow your options. So I hope this was helpful for you. If I can ever be a resource to you, please let me know. Otherwise, we will open it up for one final Q&A session. And Wayne, I'd love your help again if you are available.
I am ready and able. So we do have a couple of questions.
Okay.
What do you know about Railroad Medicare? This person heard it was slightly different.
So Railroad Retirement Benefits is another way that you can qualify for Medicare. I don't know that the benefits of Medicare are different. I believe it's just a different way of qualifying, but that truly is the extent of my knowledge. I don't think I've ever run into somebody who qualified for it, so it's not very common. So I'm sorry, I can't give you much more than that.
Why do they base the cost of Part B on your income from 2 years ago? This person's income was high then and now is lower. They're concerned it will cost them a lot to be on Medicare, and they're self-employed currently, and their health insurance privately contracted is over $2,000 per month, and they're in a sharing program instead, which has been great. They can't do both, so why would it be from 2 years ago?
Reason, and this is obviously just my thinking of why, is because you're not suddenly broke, after you have a high income and then it goes away. So the next month you're not broke. So I think they're assuming if you had a high income 2 years ago, you probably still have a certain amount of money, but that's just my guess. It's, again, try not to blame the messenger. It's not my rule. It's a Social Security rule, but I guess they're assuming you still have quite a bit of money in your account if you had that high of an income 2 years ago. The sharing thing, we might want to talk because that's a different type of individual policy if you're on something like Medishare or something like that. I'm not an expert in that, but one of the brokers I work with is very knowledgeable about those plans. So if you need some guidance on that, let me know.
If I am on an Advantage plan, can I change to the Plan G later?
So yes, you can, but if you've been on Medicare more than 6 months, you need to answer the health questions that they ask. And again, it's not that nobody can qualify, but they do ask things like recent hospitalization or recent surgeries.
I think that's all that we have for questions right now, Emily. I will take the presentation back. I want to thank you very much for, and I should share that there were 3 or 4 comments, I'm sure echoed by many who didn't submit them, that you did a great job, and they were very pleased with the information you got.
Oh, thank you very much. I appreciate that.
So thank you, Emily, and have a great day. And don't leave if you're on the presentation right now. There'll be a few things I'll cover in a minute. So thank you, Emily. Have a wonderful day.
All right. Thank you. Bye-bye. Bye, everyone.
Again, thank you for attending our webinar, the ABCs and Ds of Medicare with Emily Carrick. We appreciate it. Have a wonderful day. Bye-bye now.